The foundation of scientific progress lies in open debate. Science thrives on debate. It requires rigorous questioning and exploration of all possibilities. When dissenting voices are stifled, scientific progress is hampered. The COVID-19 pandemic brought this principle into sharp focus, particularly regarding the safety and efficacy of vaccines. Open dialogue about vaccine safety is not about spreading misinformation, it is about fostering a culture of transparency and accountability.
How many injuries did he have in that small community in his experience? And they extrapolated it around, right? But the fact they showed no curiosity, they showed no interest, and in fact, that their reaction was to punish the individual for speaking up. That is what it means, that the system is flawed itself.
When doctors are afraid to voice legitimate concerns, patient care suffers. History teaches us that scientific consensus can be wrong. Challenging established paradigms is often how breakthroughs occur. The COVID-19 pandemic presented a rapidly evolving situation with new data emerging constantly. In such a context, flexibility and openness to different perspectives are paramount. Dismissing or silencing dissenting voices within the medical community ultimately undermines the scientific process and erodes public trust.
They would be witnessing all those who spoke up against them fight their responsible bodies, their professional bodies, attack them. And so it's quite an odd situation where doctors, I think, would say, well, was I really free? But now you have a court saying, well, yeah, you always had the ultimate responsibility.
The landscape of legal accountability regarding COVID-19 vaccine-related injuries is shifting. Traditionally, liability for vaccine injuries has largely fallen on manufacturers. However, recent developments suggest that individual doctors may face increased legal risks.
Canadian lawyer Lisa Miron has raised concerns about this shift, highlighting the potential for doctors to be held liable for vaccine-related adverse events. Miron points to a European Court of Justice decision as a potential harbinger of this change. While the ECJ upheld the authorization of COVID-19 vaccines, their ruling emphasized the responsibility of doctors to advise patients appropriately and potentially withhold vaccination in certain cases. This suggests a heightened expectation of individual doctors to assess and mitigate potential risks, potentially exposing them to greater legal scrutiny.
And I can't, provide an opinion in law in that respect, but I can give you how I interpret it. And the request was to withdraw the the advertising or the presence of the shots on the market, and the court refused. And in refusing, they indicated something quite important. Two things: that doctors were always free not to administer the shots and to advise against it. And in the second instance, that the doctor should have been providing prescriptions for this COVID vaccine. And so that's a lot to unpack, and there's a lot of directions we can go with that.
This shift in liability raises serious questions about the duty of care owed by doctors to their patients in the context of mass vaccination campaigns. Doctors are increasingly caught between following public health guidelines and exercising their professional judgment. This tension is further exacerbated by the fact that long-term effects of COVID-19 vaccines are still being studied.
And I said in 2021, if and when the brown stuff hits the fan, they're going to blame the doctors. Because they're going to be saying, I could imagine it, the politicians would say, well, we're following the science. The scientists would be saying, Well, this is what the studies showed, but we didn't know that there were injuries. Goodness, you mean patients actually got injured and got sick? How did you do that? Why didn't you tell us? And so everybody would then start shunting responsibility, even though the doctors were at risk for speaking out. Remember, doctors were put under the threat, and in some countries, they lost their jobs for just not taking the vaccine. I'm not even talking about speaking out. They, just for their job, they were required to have COVID vaccines, whether or not they had natural immunity. They just had to have them, and if they didn't get them, they would lose their jobs. In that, how could you expect doctors in that kind of environment to therefore be trying to tackle these issues?
The COVID-19 pandemic witnessed a concerning trend of silencing medical professionals who dared to raise concerns about vaccine safety.
Doctors who voiced dissenting views, even when grounded in scientific evidence, faced disciplinary action, professional ostracism, and media smear campaigns. This suppression of dissenting voices created a chilling effect, discouraging open dialogue and critical appraisal of vaccine-related data.
Regulatory bodies, medical licensing boards, and hospital networks played a role in enforcing this climate of silence. Doctors who deviated from the official narrative on vaccines risked jeopardizing their careers and reputations. This pressure to conform stifled debate and discouraged doctors from reporting potential adverse events, hindering our understanding of vaccine safety.
This suppression of dissent was not limited to any one country but played out globally. Medical professionals who questioned the safety or efficacy of COVID-19 vaccines were often labeled as anti-vaxxers or spreaders of misinformation, regardless of their actual views or qualifications. This tactic of silencing dissent through ad hominem attacks and mischaracterizations further polarized the debate and discouraged nuanced discussion.
Here it is, written in a decision that doctors should have decided whether or not that individual should be administered that vaccine. They should be given a prescription. And so when a prescription is given, certainly what you usually get is adverse events, possibilities of a discussion with that doctor. And so it changes what was done from a push, kind of from a central authority, to now making individual doctors everywhere possibly liable because of this decision. I think is something that doctors should bring up with their insurers, and if they do have a doctor or a lawyer, should bring up with them as well.
Protecting free speech within the healthcare system is paramount. Open dialogue, even when it involves dissenting views, is essential for both patient safety and provider protection. Doctors must feel empowered to voice concerns, report adverse events, and engage in robust scientific debate without fear of reprisal. When medical professionals are silenced, patients are denied the benefit of their expertise, and potential harms may go undetected. Moving forward, it is crucial to foster a culture of transparency and openness within healthcare.
This includes protecting the right of medical professionals to raise concerns, debate scientific evidence, and advocate for their patients without facing censorship or retribution. Regulatory bodies and medical institutions must prioritize patient safety and scientific integrity over the enforcement of a singular narrative.
I think one of my theories is that the laws that are passing themselves are the evidence of conspiracy. The laws and policies and bilateral and multilateral and treaties themselves are the proof of the conspiracy. And I believe that when you set up a system to silence one side of the debate, you become responsible for what follows that silencing. So if one side of the debate is not in the public square, and that is the side of the debate that errs on caution, and that is clamoring, in fact, to indicate that injuries are so rampant and so horrific among their patients, and that debate is silenced, then I believe that liability should flow to the system that did the silencing. And it's not to say that doctors in certain indications shouldn't themselves find that liability, but the system that set up that silencing is the problem.
Furthermore, it is essential to recognize that medical knowledge is constantly evolving. The COVID-19 pandemic highlighted the need for humility and flexibility in the face of uncertainty. Dogmatic adherence to any one perspective, especially when dealing with novel medical interventions, can have detrimental consequences. Embracing open dialogue and encouraging respectful debate within the medical community will ultimately lead to better patient care and a more robust healthcare system.